The For All Women campaign was a $16.3 million fundraising effort. I think a lot of times there's that misnomer. It's like, why are you calling it For All Women if you're adding on to the NICU? But we're adding on to the NICU because the NICU is growing at such a substantial rate that 80% of the time we were overflowing not only on the 3rd floor, but up onto the 4th floor, and those are our adult patient beds. And so Methodist Women's Hospital is a women's hospital. And for some women, that will mean labor and delivery, and for some families, that will mean NICU. But there are plenty of other women who have other health considerations that are equally important to us.
We have already seen growth in our surgical services, and in particular, our breast cancer program. And when we are able to see more of those patients here at Methodist Women's Hospital, we can serve more patients.
I think for a lot of women, this is really a comforting place for them and to come and receive their care. They had their babies here, and so they're very familiar with this facility and just the comfort and knowing that they're going to be well taken care of.
More space was critical, but whenever we add more space, we have an opportunity to look at the technological advances. And so the last NICU edition, we added Hero, which was that algorithm to be able to early detect sepsis, infection in little itty bitty babies. This time around, we were able to add something called Angel Eye, which the easiest way to think of it is kind of similar to what many parents know that have a child in daycare, that camera that allows you to have your eyes actually on your child.
We had a 25-weeker, Nora, and we were here for 115 days with her. And then we also had a 37-weeker, our son, and we were here for about a week with him. It's definitely a part of our lives that is so close to our heart, and I think for other families too, it's so close to their hearts. And to see like a brand new expansion for all the babies to come, it just means so much.
The first person that I saw in the lending library with his granddaughter, Olivia, and I mean, she had a bow as big as her face, and he was reading to her just so patiently and just really appreciating the experience. And it struck me, this is a book that was probably $10. You don't have to give $1 million to be able to change someone's life. Sometimes it's as easy as donating a couple of dollars for a book.
Realize the impact that you are doing, regardless of how small or big it is. With you standing behind it in whatever role you are and whatever you are giving, providing, hours, financially, it is an impact, and it's a positive impact, and know that you are making a difference, and every little bit of it counts.
Every contribution to this project is a testament to how people feel about Methodist, and that's whether the dollar came from our community or the dollar came from our own employees and physicians that work here. We believe in the care that we provide to our patients in our community. It's our mission, it's what we believe in, and people were proud to give to something that's so good.